Okay, I went ahead and got a call that we're going to need a patient to be manually ventilated. So I went ahead and grabbed my supplies. I have a Ambu bag and some different oropharyngeal airways sizes. I went ahead and looked up the patient's chart just to see what kind of patient we're having, if she has any facial trauma, neck injury, that's going to come into play, how I would treat my patient in response to movement and things like that. So upon entering, I see that the patient's not responsive. The nurses are working on her. I'll go ahead and wash my hands, put on some gloves, and I'll grab the different sizes of the oral airways that I got. I'll go ahead and measure just real quick and see which one would be the best fit. This one goes all the way from her mouth to the tip of her ear, so that looks like that'll be the best fit for us here. I'll go ahead and insert the oral airway. I'm going to just tilt her mouth open, or chin tilt a tad here, and go ahead and insert halfway, and twist 180 degrees. Now the oral airway is all the way down into her mouth there, so I can go ahead and the flange is resting on her lips. We'll go ahead and hook up the Ambu bag to oxygen here, flow, and the best position is to be at the head of the bed. I could go ahead and grab with my lower fingers here and do that chin tilt and get a tight seal around the patient's mouth. I'm going to start ventilating my patient here. What I'm looking for is chest rises to make sure that her lungs are filling up with air. And I'm also allowing the bag to refill each time. We want to make sure we're ventilating the patient 12 to 20 breaths per minute. And if she has any spontaneous breathing, I'm going to try to correlate my administered breaths with those spontaneous breaths that she has. And I'm going to continue doing this until further instructions if we're going to go ahead and intubate the patient or if she starts breathing on her own.